Welcome to Know Before You Go, Botox brand comparisons and the Daxxify difference. My name is Dr. Lisa Vujic. I'm the owner of Renew Metaspa and the Renew Metaspa Training Institute. I'm a master aesthetic trainer and I am board certified in aesthetic medicine as well. I have been a guest lecturer at many association meetings and I'm also a trainer. However, I am not a lecturer nor a trainer for any brand of botulinum toxin. So this video is not a paid commercial. This video is me imparting to you my many years experience with botulinum toxin, every brand that's been on the market. I'm going to try to explain to you the differences between the different brands so that you understand when switching from one to another what to expect. As you may know, there's more than one brand of botulinum toxin type A for cosmetic use currently available in the United States market. In fact, there are 5 as of the date of this video, May 2024. They are Botox, Xeomin, Dysport, Jeuveau, and Daxxify. Botulinum toxin cosmetic use is extremely safe. As of February of this year, there were over 12,000 clinical publications on the use of botulinum toxin. It's been FDA approved since 1979 and has been used cosmetically since the 1980s. The safety profile between the different brands really does not differ. They all have the same active ingredient. They all have the same black box warning about the possible potential for distant spread of effect, and their side effect profile really does not differ much. So that's really not going to be the focus of this brief video. We are going to, however, look at the differences between the different products, especially in terms of potency and duration of effect. In this table, I've listed them from left to right in order that they were FDA approved. You can see the year of FDA approval, starting in 2002 with Botox Cosmetic and ending in 2022 with Daxxify. Now, it might surprise you that the active ingredient, which for all of them is botulinum toxin type A, is not the only thing that's in the vial. 3 of the 5 brands contain something called non-toxic accessory proteins. We refer to them as NAPs. Now, these proteins are not required for stability or for effect. I essentially consider them impurities. They're just left over from the manufacturing process, and it's felt, unfortunately, that they may contribute to the formation of what are called neutralizing antibodies, meaning that for some people, their immune system may notice these proteins and build antibodies against them. As you see here, there are 2 brands that do not have NAPs, and those are specifically Xeomin and Daxxify. The next line down is stabilizing peptide. That is only contained by Daxxify. Daxxify has a very unique peptide, which I'll show you in just a moment, allows it to bind faster and stronger to the nerve cell receptor, and that impacts how effective the product is and how long the result lasts. The next line states excipients. Excipients do enhance the stability of the product from the point of manufacturing to the point of injection. Note here that all of the brands except Daxxify contain HSA, which is short for human serum albumin, along with another compound such as sodium chloride, or in the case of Dysport, lactose. Only the Daxxify does not contain these excipients because it has its special stabilizing peptide. I've then listed for you the recommended dose in units for an area such as here, the glabellar lines, which you might consider to be between the brows. This is essentially the dose that the manufacturer recommends be placed in this region. For Botox Cosmetic, it's 20 units. For Dysport, it's 50 Sperian units. For Xeomin, it's 20 units. For Jeuveau, it's 20 units. And for Daxxify, it's 40 Daxxify units. Now, you might wonder why this number is so different in some instances. The fact is that the units of one tox are not interchangeable with the units of any other tox. There is no standardization in the Botox cosmetic industry for how to count units. Each company has its own proprietary way of determining this. So in short, what this means is that 20 units of Botox Cosmetic does not equal 20 units of Xeomin, which does not equal 20 units of Jeuveau in terms of the amount of active ingredient or necessarily the result or effect you might get from that dose. The Dysport units are really entirely different. They're called Sperian units. And again, the Daxxify units completely different again. So I can't emphasize this really enough. But another way I can show it to you is by showing you how much active ingredient is present in that recommended dose. And that's the last line of this table. So at the recommended dose listed there, you'll notice that Botox Cosmetic has 0.18 nanograms of active ingredient. Dysport has 0.27 nanograms. Xeomin has only 0.08 nanograms. Jeuveau has 0.12 nanograms, and Daxxify has 0.18 nanograms. Now, why am I subjecting you to these numbers? Well, that's because it's really important in terms of predicting the treatment effect. There is a very significant dose-effect relationship when we're talking about botulinum toxin for cosmetic use. And so if you're used to getting 20 units of Botox cosmetic, which is giving you a dose of 0.18 nanograms of active ingredient, and then you switch to, say, 20 units of Xeomin, which is only giving you 0.08 nanograms of active ingredient, your experience from that injection is likely to be quite different, either in terms of the effect it has on your muscle or the duration that your muscle relaxation lasts. If this is a little bit confusing, don't worry, stay with me. I'm going to clarify this in some different ways, show it to you in some different ways where it'll make more sense. But dose really is important. The other thing to understand is that you might look at this chart and say, heck, I want the 50 units of Dysport all day long because that has the most active ingredient. But in fact, the product on this list with the highest likelihood of the longest duration of action is actually the Daxxify because of that special stabilizing peptide, and I'll show you why. These differences in the quantity of active ingredient, both per vial and per recommended dose, have been well outlined in the medical literature, as seen, for example, in this article in the journal Toxins, published back in 2018. So let's do the math and look at this in a way that might seem more clear. In the top row of this table, I have the recommended dose for the glabellar lines, which is the muscle group between your brows, for each of 4 brands. I've also listed the quantity of active ingredient contained in that dose. So you saw all this in the slides before. But now let's take the brand Xeomin as an example and calculate how many Xeomin units we would need in order to have the same potency as the recommended dose for each of the others. So based on the data that I showed you, you would need 30 units of Xeomin in order to have the same amount of active ingredient as 20 units of Jeuveau. You would need 45 units of Xeomin in order to equal the same amount of active ingredient as is found in 20 units of Botox cosmetic. You would need 68 units of Xeomin to match the Dysport dose, and you would need 45 units of Xeomin to match the Daxxify level of active ingredient of botulinum toxin. Now, nurses and physicians can certainly exceed the manufacturer's recommended dose when treating muscles, and we often do that. The point here, though, as we'll get to again later, is that if we need to go up that high on the Xeomin units to get you the same experience as what you're used to having with one of the other products, and if you're paying per unit, certainly, then your cost for having the Xeomin done is going to rise dramatically. Now, Daxxify, as I started to allude to earlier, is a bit of an outlier here, because there's one other thing to understand when talking about this, and that is that the peptide that Daxxify has gives it an advantage. It allows the product to bind better, faster, and more of the dose gets to the target, to the nerve cell membrane, or in other words, less is lost to runoff, so more of the active ingredient actually gets to where it's supposed to. And because of that, it will seem like the Daxxify acts as if it's an even higher dose because it's more efficient, it binds better. So many of our clients get twice as long a duration with the Daxxify compared to what they get with their prior tox, as long as we're giving them the recommended dose for the region. Now, if you underdose Daxxify, you won't get the double duration, okay? So if someone has Daxxify and they don't give you the recommended 40 units, they give you only 20 units, then it's highly likely you won't enjoy that 6-month duration that you were hoping for. Because again, dose is extremely important in terms of both the effect that the tox has on your muscle and how long that effect lasts. This peptide in the Daxxify is the first of its kind. It's 35 amino acids long, and on each end it has a sequence of 9 amino acids, which mimics one that is used by the HIV virus when it infects cells. And I mention this only because there's a lot of misinformation thrown out onto the internet and elsewhere that suggests that Daxxify somehow is related to the HIV virus or comes from the HIV virus, and that is absolutely false. It simply has a peptide, a portion of which mimics a peptide that is used by the HIV virus. So the Daxxify peptide has otherwise nothing to do with HIV virus. And this slide shows you essentially a cartoon of the neuromuscular junction, where the neuron meets the muscle cell. Believe it or not, when we inject botulinum toxin, not all of it binds where we want it to. Some of it does get washed away, and that's harmless. It doesn't have an effect anywhere else, but it's also not effective if it doesn't bind to the nerve cell membrane in the region you place it in. In this cartoon, the green is the nerve ending, where the signal would come from normally for the muscle to contract. And you can see, as depicted here, there are special receptors at the nerve ending where the tox binds. The nerve membrane is negatively charged, and the Daxxify peptide is highly positively charged. So this is the perfect scenario of opposites attract. Just like the opposite poles of a magnet. If you remember playing with magnets in school, how the magnets would get sucked right up together due to that polarity. Well, that's what's happening with the Daxxify and the nerve cell receptor. A higher percentage of the botulinum toxin gets incorporated, gets taken up by the nerve cell receptor, and therefore the Daxxify dose, even though it's quote-unquote only the 0.18 nanograms, similar to Botox cosmetic, is going to have an effect as if it's a lot higher dose because of the efficiency of this binding. So let's simply say more of the dose gets delivered. And this has been shown once again in the medical literature. As you see here, they state both doses actually contain an identical quantity of the neurotoxin, the 0.18 nanograms, and yet the Daxxify has greater duration. So this is more likely attributable to its unique formulation and not a difference in active ingredient. Now, interestingly, if an unwanted effect does occur, let's say that there's a lid droop, and in other words, the toxin affects a muscle you didn't want it to. That's the thing most of us feared when Daxxify was first coming out, was that if it is so strong and its effects last so long, what if you get an effect you don't want? Will that also last twice as long? And fortunately, it turns out the answer is no. When you get an unwanted muscle relaxation with the Daxxify, the duration of that adverse event was essentially the same as the duration of that event with any other tox on the market. So that was actually very reassuring. Another thing I liked about the Daxxify studies is that they set the bar really high. In order to be considered a success, severe glabellar lines had to drop to none or mild, and moderately deep glabellar lines had to drop to none. Despite holding the standard that high, the median duration of the Daxxify dose was a full 6 months. Median duration meaning at least 50% of people got to the 6-month mark and still had none or mild movement of the muscle. Okay, so their effect hadn't worn off already. They were still at none or mild. And some of the patients in the study got to 7, 8, and 9 months before their effect started to wear off. So I've been talking a lot about dose and duration. And of course, it makes sense to wonder, well, what if we just push the dose of the other brands? Can we also get to that 6-month and beyond duration? The answer is yes, but at some point you do hit a wall. So for example, Dysport, if you raised the dose to 100 units, you could get to 36 weeks, but if you raised it to 125 units, you only got to 36.6 weeks. With Xeomin, if you raised the dose to 75 units between the brows, you could get to 30 weeks, and if you raised it to 100 units, that's 5 times the recommended dose, you could get to 38.6 weeks. Interestingly, with Botox Cosmetic, once you got to 40 units, you got 24 weeks, but further increases in dose did not prolong the effect. And understandably, if you're paying per unit, it may be cost prohibitive to be dosing as much as 100 units for just one region. So let's get back to practical again. Ideally, your botulinum toxin consultation will review what your history is with past use of various brands of Botox, an assessment of what your concerns are, what areas you want to treat, what goals you have. I'm talking about the balance of muscle forces, the muscles that elevate, the muscles that pull down. We certainly look at whether you have any contraindications to the treatment and make sure that you understand what types of wrinkles that the tox can help with and what types it doesn't have any impact on. It's important that you understand that there is also individual variation. People have differences in muscle bulk, differences in how many receptors they have in their muscle, and also differences in terms of how long it takes their nerve cells to regenerate the SNAP proteins that are cleaved by the toxin. We call this your rate of metabolism, and we can't control that. So that's a long way of saying that 20 units of Jeuveau in one person's muscle can produce a different effect than 20 units of Jeuveau in person B's muscle, even if it looks like that muscle is the same size and shape. And finally, finally, of course, we need an understanding of what your budget is and to be able to advise you as to how to best use those funds based on what we're seeing anatomically. There are a few things to be considered if someone feels that their Botox didn't work. Number one is underdosing. If not enough units are delivered, not enough active ingredient for the muscle bulk, for the surface area, for that person's, receptor density, if the dose is not enough, the experience won't be a good one. Either it won't relax the muscle sufficiently, or it will relax the muscle immediately, but then the effect will poop out too soon. Consideration number two is always mismatched expectations. Understand that Botox doesn't fill a line. It relaxes the muscles that make the lines deeper with muscle movement. And so if you have a deeply etched line, it's not likely to be erased by Botox, at least not initially, but perhaps gradually over time with consistent use. Third consideration is technique. If the depth of injection, if the level of the skin where the dose is placed is not ideal, if it's placed too superficially in an area where the muscle fibers tend to be deeper, for example, it's not going to have the best effect. The fourth I consider always is product degraded. This means that there are instances where the product could lose potency. For example, if it's mishandled, if it's not kept at the right temperature, or perhaps if it's been sitting on the shelf too long after it was reconstituted. Maybe an injector doesn't get a high volume of clients and they mix a vial and then it sits in the refrigerator for an extended period of time before they get the next client in. That could lead to, over time, product degradation. If so, then you're not getting the ideal dose, and that's going to impact your effect. And finally, neutralizing antibodies. There are documented people who are resistant to botulinum toxin type A. I've come across only a few in a couple of decades of injecting, but they are out there. They're very rare. It's certainly possible. If you're resistant to botulinum toxin type A, you will be resistant to all of the brands because they all have the same active ingredient. If you do decide to change injectors, it's very useful if you can try to get your most recent injection note, which would hopefully show the brand that was used, the dose, and the placement of that dose. As you can see here in these 4 different diagrams, these are different placements, different numbers of units per injection site. You can see how much variability there can really be in terms of dose placement and in terms of units per injection point. Now, most people who come to us for the first time who've had tox done elsewhere don't have this information. It's not the end of the world. I'm just suggesting if you want the most consistent experience and if you're able to get that note, it does help your next injector to deliver potentially exactly what you were experiencing before, because they now have the map, per se, of what you were used to getting. One of the most common reasons for someone to try a different injector is that they see a big sale somewhere and they get that fear of missing out. But let's look at how that big sale might not be such a bargain based on what we've reviewed today. On the left, I've mapped out a 2-treatment area. First for Daxxify at $600 per area. If this person were able to get the 6-month duration, they would have a $2,400 per year spend, or actually less if they were doing our free membership program. So let's say then that their lowest cost might be $2,040 for the year with a discount. If instead of doing Daxxify, they did Jeuveau with us, again at typical doses for these areas, and at $13 per unit, they would spend $2288 per year, so a little less. And of course, they too could bring that down by taking advantage of our Tox Club, where they would pay year-round only $10 per unit. At $10 a unit with our Tox Club, their cost would actually drop to about $1760 for the year. Now, what if we looked at Xeomin doses? Let's say there's a Xeomin sale somewhere, and they're charging $10 a unit. Now, in order to get 0.264 nanograms of active ingredient, which is what would be delivered in that Jeuveau dosing there, remember we've got to do that conversion, it would take 66 units of Xeomin, and I've shown you how that could be delivered into those 2 areas. At $10 a unit, that would cost them $660 or $2,640 for the year. That's higher than either of the 2 previous examples, despite the fact that they're paying $10 a unit. Now, what actually happens? What actually happens is they don't do 66 units. What happens is they do more like the final example on the right that I gave you. They might get 20 units between the brows. They might get 8 units per side around the eyes. That ends up being 36 units at $10 a unit. Here's the problem though. That is not going to last 3 to 4 months because the dose is too low. In fact, that's only going to last likely 2 months for the average patient. And so if they're doing that dose every 2 months, they're going to be spending over $2,000 a year because that dose of 36 units has only 0.16 nanograms of active ingredient, which is substantially lower than what you're comparing it against. So you might be wondering by now, why have Xeomin at all? But let me be clear about this. Xeomin is not bad. We carried Xeomin for a time. It's a perfectly acceptable botulinum toxin. It is certainly marketed as more quote-unquote pure, as you can see here from their website. And they have a whole video about their manufacturing process and how it extracts the non-toxic accessory proteins. And there's the suggestion, certainly on the internet, that those accessory proteins are problematic. But at the end of the day, if you dose it appropriately, it will work. If you're using Xeomin and you're happy with it, there's no need to mess with success. The purpose of this educational piece really is to help you if you're switching from a more potent product to Xeomin. You should have the dose discussion with your injector. You should really know these differences in order to be an educated consumer, in order to better evaluate what it is you're purchasing. When you understand that the units are not interchangeable, now you can put that into your decision-making process and decide if this Xeomin deal is really going to be a deal for you. And as you see, even on the Xeomin website where they say state-of-the-art manufacturing process, they talk about the clean beauty trend and suggest that this is a cleaner product. We use 2 filtration steps. We isolate the therapeutic component. And then in the very next sentence, they say head-to-head studies evaluating the relative risk of immunogenicity due to the presence of or absence of these unnecessary proteins have not been performed. So they basically tell you in that paragraph, we go through all of this process to get these proteins out of there. But by the way, we don't really have evidence that the presence of those proteins is a problem. So just food for thought. We stopped carrying Xeomin when we started carrying Daxxify. Why? Because in Daxxify, we have a product with a high potency and a long duration that doesn't have any human or animal byproducts, does not have the non-toxic accessory proteins. So once we were carrying Daxxify, it really made no sense for us to continue to carry Xeomin because Xeomin was not offering our clientele an advantage any longer, and it had the lowest amount of active ingredients. So to me, it made no sense any longer to be carrying 5 brands. And so to summarize, I hope that this information has taught you that brand and dose both matter, that the units from one brand to another are not interchangeable. Certainly injector experience and skill, delivery of the product matters. Please avoid Groupon deals because they traditionally stink. I can't tell you the number of times people have come to me having gone to a Groupon deal and felt that it didn't work, it didn't do anything, et cetera, et cetera. It just has a high likelihood of being a bad experience. So don't use a Groupon experience as your guide to what tox can do for you. I would suggest that you avoid Botox parties. Again, with this type of a process, you want consistency. You want a stable injector, someone who's going to be there for you over time, make adjustments as needed. If you're jumping around to different Botox parties, you're really just not getting a consistent experience, and it's going to be very frustrating for you. If it sounds too good to be true in terms of a deal, it probably is, so always keep that in mind. And hopefully you've learned too that light dosing, although it can be used preventatively, we call that baby tox. If you're beyond the baby tox range, if you already have established lines and wrinkles, light dosing is going to be very frustrating for you. It won't last long. You'll feel like you're always chasing the dose. It's not really the kind of Botox experience we want to deliver to our clients. And finally, if something doesn't look right after your Botox has kicked in, please let your injector know, because a lot of times if something doesn't look right, it actually means that you were underdosed, not overdosed. Of course, both can happen, but always ask, always go back to your injector if you think that something is off or something is not as you expected, and allow them the opportunity to explain what's going on and hopefully correct that experience. Thank you so much for your attention. Happy to answer any questions. If you have them, just send them to us at info@renewmetaspa.com.